I've been very interested in the work of this economist named David Galenson, who has this idea that innovation comes in two forms. One he calls conceptual and one he calls experimental. And he gives Picasso as the kind of example of the former. Experimental innovation is where you start with a big, bold, revolutionary idea, which you can define, and then you very rapidly implement it. And Picasso is a beautiful example of that. He has this idea about how to revolutionize art, and in short order does precisely that when in his early 20s. Cézanne is an example in Galenson's mind of experimental innovation, where he never has a big idea. He doesn't start with some revolutionary notion. Rather, what he does is he proceeds very slowly and gradually through trial and error. Focus of my talk today was really to say, is the kind of healthcare revolution of which we are all a part, is it a Picasso problem or is it a Cézanne problem? And I think it very much is a Cézanne problem, but many people in positions of authority have been treating it like it's a Picasso problem. And so from that, I think all kinds of interesting implications ensue. And that's a big difference between these two kinds of innovation, that if you're going to innovate experimentally, you are, by definition, you have to deal with a certain amount of uncertainty. You are incapable, by definition, of precisely describing where you're going to end up and how long it's going to take. And numbers of fields deal with this uncertainty all the time. So I talked about the hybrid engine. It's an idea that's been around forever. That idea was first floated 100 years ago, but no one knew how to do it. And the reason the Japanese developed the hybrid engine is that they're willing to undertake this highly uncertain project. They kind of plunge in and they say, we don't know how long it's going to take or how much it's going to cost, or even if it's going to work, because no one was sure you could actually make an engine made up of two very different models side by side. And but the Japanese plunge ahead and do that and succeed because part of their definition of what it means to innovate is this Cézannean notion of uncertainty. Pharma is another great example of an industry that's profoundly comfortable with this notion. Even in the age of rational drug design, pharma companies routinely engage in projects where all they know is they have something cool. They don't know how it's going to work, whether it's going to work, and what it's going to work for. But they go and do their clinical trials and wait for something serendipitous to happen. And I think that's going to be true of some large portion of IT innovation, that there's just so much radical uncertainty in this world that who knows what the solution is going to look like 5 years from now. We can't know. What we have to do is develop a model of innovation that's comfortable with not knowing. I really worry that that whenever we're in the midst of some kind of technological revolution, as we are in the case of healthcare, that our expectations are often out of line with reality. We think when we use that word revolution, we're talking about something that's going to happen easily and quickly. And in fact, and we neglect the fact that even the greatest ideas in the world often have a very difficult time making it in the marketplace because they require a second step to be accepted, and that they must be presented or framed to the public in an appropriate way. So a really good example is just how difficult it was for American government to convince Americans to wear seatbelts. So there's an innovation of indisputable value. The lives, tens of thousands of lives can be saved by this thing every year. Americans weren't wearing them. For 10 years after they were introduced, seatbelt use rates in America were about 20%. And people began to realize it was a framing problem, that what had happened in all the years of advocacy of seatbelts is that they had been framed as an act of government intervention in the liberty of drivers. And Americans are profoundly hostile to anything they perceive as an attempt to constrain their liberty, particularly when the attempt comes from the government. And so the people who were advocating seatbelt use realized we have the wrong frame, went back to the drawing board, and decided they would stop talking about adults and present seatbelts simply as a way of saving the lives of children. And so they just passed seatbelt child restraint laws, and everyone accepted the logic of that because children were obviously vulnerable. And what happened was that children became the advocates for seatbelt use. And they began chirping up from the back seat and asking their parents why they weren't wearing seatbelts. And that's when seatbelt rates rose to 70% in America, very quickly, actually, in 3 years. So there's a great example of there is two parallel processes that had to happen for the revolution to take place. One was the actual innovation, and the second was understanding how to frame that innovation in the eyes of the public. And that second piece is crucial for healthcare. That, you know, just a case of digital records, which are always, opposition to digital records is always framed in terms of the fact that they are a threat to privacy. That is neither a terribly rational argument. It's not clear to me why a digital record would be easier to steal than a paper one, but also irrational in a sense that it's also not clear to me why privacy is a more important consideration than safety, efficiency, and cost. I, for one, could care less if anyone wants to read my medical records. So, I mean, but there's a case where it's just been framed a certain way, but, you know, regardless of how brilliant any advances are in this particular area, they won't go anywhere until we deal with the frame, the inappropriate frame. What's happening in many different fields, from healthcare to sport to you name it, is that we are beginning to generate evidence which contradicts, some cases confirms, but in many cases contradicts deeply held cultural notions. So, classic example is I wrote the story about American football, which points out that very new medical evidence is emerging that suggests that the game may be as dangerous as boxing. In other words, and so there's a game to which Americans are fervently attached, which we now have evidence which says that it's actually that the risks incurred by the players may be unsupportable. And this is going to happen in healthcare as well. We're going to learn things that are going to challenge deeply held notions about the way the business has been conducted. I suspect, for example, that one of the things we're going to discover, and we're already discovering this, is that doctors are far more flawed practitioners of effective than either we or they believe at the moment. We're going to discover they're not very good. And there are all kinds of ways we can make them better, but those are going to require radical changes in the expectations of patients and the attitudes of doctors. And all of these fights I've been describing are not easy. But what concerns me is that they are all fights that are outside of the comfort zone and skill set of the IT community. We can't ask the same people who create these technological innovations to also be the ones carrying on the cultural battles. Those are two totally different battles. And I think it's very important for those of us on the outside to understand that we have a role to play as well, that we're going to have to fight the cultural portion of this in order for society to reap the benefits of the technological revolution that's being conducted by others. I think we're going to look back with horror at two things. One is that at the way in which the modern hospital is, we're going to look back at hospitals with horror. We're going to say, how on earth did we let sick people go into a place that bred sickness and error to the extent that it does and that costs so much? And two, we're going to look back with horror at how we gave doctors so much responsibility without giving them a corresponding set of tools to help them make good decisions. It's like it would be as if we allowed pilots to fly without radar. It's that level of we're going to be shocked that we sort of hung the medical profession out to dry the way we did without necessary support.